Hello, viewers, and welcome to the October edition of First Friday Live. I'm Wanda Holt from Holt Health Insurance. So I hope you're having a great Friday. Fridays are usually my office days, and so it's kind of a catch-up day for me. Well, I just wanted to talk a little bit about what's coming up in October. Of course, open enrollment for Medicare starts in about 10 days on October the 15th. Open enrollment for Medicare runs from October 15th to December 7th, which is Pearl Harbor Day. And during that time, if you're on Medicare, you can change your plan. So you can switch from a Medicare Advantage plan to a different Medicare Advantage plan. You can switch from a Medicare Advantage plan to a Medicare supplement and pick up a drug plan. You can drop all of that, although penalties might, the government might charge you penalties if you dropped your drug plan, so you probably don't want to do that. But during open enrollment, you can make all kinds of changes, anything that you need to change or want to change. Since we're so close to open enrollment, we now know what the plans for 2018 look like and what the benefits are going to be for the different plans. And there's some good things out there, especially in the Medicare Advantage space. Medicare Advantage is based on what county you live in. So depending on what county you live in will be what plans are available to you. And so it's an exciting time. There's not a lot of good news in health insurance right now. But in the Medicare space, there really is some good things going on, and particularly with Medicare Advantage, we're seeing some exciting benefits being added, and also some really good premiums there, and so we love that. So what else is going on? You know, it's just kind of a time for change, isn't it? I think always in the fall, we start seeing the leaves change. We start looking toward the new year, and we're just sort of naturally thinking about these things that are changing. And I live in Nashville. I am actually a native Nashvilleian, which is kind of unusual these days. And for us, you know, so much has changed. Our skyline has changed. I remember when I was a girl growing up in Nashville, the LNC Tower was really the only skyscraper that we had. And now we have multiple tall buildings and new ones being added all the time. And when you drive downtown, it's really the skyline is full of cranes right now, construction cranes. And so it's kind of exciting, but also a little worrisome as far as the traffic is concerned, because that is more and more of an issue for us. But a lot of change going on. We're seeing the growth in Nashville spread out on all sides, and depending on who you are and, you know, how you feel about things, whether that change is good or not so good. But like all other change, it's inevitable, and so we just have to take it in stride. So when we think about change in the Medicare space, one of the things that I always want to remind you of as we approach open enrollment and the potential for changing your coverage, whether you're on a Medicare Advantage or a supplement, or particularly your Part D drug plan, is to keep in mind your prescription drugs, because this part of your coverage can change drastically from year to year. My husband and I were just looking over his prescription coverage for 2018 because yesterday he received what the government calls an ANOC letter, and it stands for Annual Notification of Change. And so every year if you're on a Medicare Advantage, you'll get an ANOC letter, which will outline what is changing on your plan. And that way, if you like the changes, fine, you don't have to do anything. Or if you don't like the changes, it gives you an opportunity during open enrollment to make any necessary changes. Well, one of the things that we noticed on his ANOC was that his plan showed different copays for preferred pharmacy and standard pharmacy. Well, the obvious question was, okay, what is, which pharmacies are preferred with my plan and which ones are standard? And so we had to do a little research online to figure that out. And once we figured it out, we realized that really to maximize his savings for 2018, he's going to need to change pharmacies. And that would not have been obvious. So, of course, that's one of the reasons that I think you need to work with an agent, because we can help you look for those things that you may not be aware of otherwise. Also, his particular plan for 2018 is going to have some assistance through the coverage gap. And so that's going to help him a great deal as well. And so he needs to stick with the plan he's on. So again, not something necessarily that is going to just jump out to you, but if you know how to look at those ANOCs, if you know how to analyze your situation to your plan, then you can maximize the benefits that you're offered on your plan. And so if you have questions about that, comment that way, I guess. Comment in the box there or below. Give me a comment, or you can always private message me, or you can always call me, and we can get together and talk about those changes that are going on for 2018. Or you may just want to know, what the new benefits are, or the extra benefits that are out there. Also something that I don't know that I've ever mentioned is the state of Tennessee offers something called extra help. So if you're struggling just paying for your prescription drugs to begin with, regardless of what the copay is, then talk to me, because I can help you apply for a low-income subsidy, which a lot of people call extra help. And so if you need information about that, again, put it in the comments somewhere, or send me a private message or call me, and we'll be glad to do that. I do have some events coming up that I have already scheduled during open enrollment. I have at least one a week coming up. I think they start the first week of open enrollment. So the week of October 15th going forward, I have at least one event every week somewhere, and sometimes two a week. And so what those do is it gives you an opportunity to come by, talk to me, and we'll talk about what's new and what's going on. Those are sponsored by the different carriers. So I'm doing those with 2 different carriers this year. And so the information will be different at each one of them. So let's see. So if you want information about my events, you can go to my website, which is holthealthinsurance.com. I will put those events on there so that you know where they are and what time they are. All of them will be, at this point, all the ones that I've scheduled are informal type events, and so you can just come and go. So if it says 10 to noon, you can come at 11:30 and I'll be there. So that's the events that I have coming up. Of course, I also do in-home appointments. So if you would like to talk with me specifically about your situation. And one of the things that I do when I was talking about the prescription drug plans is I can, if you would like, I can check your prescription drugs, and we can go into what plan might be best for you. And so if you'd like for me to come to your home, again, leave me a message, or private, that might be better, private message me about that, or give me a phone call, and I'll be glad to help you with that. Also, you can contact me through my website, holthealthinsurance.com, and just click on contact, fill out the little form, and it'll shoot me an email. So that works as well. All kinds of ways to get in touch with me. Let's see. What else did I want to talk about today? Oh, so all the things talking about change, I wanted to just give you a little heads up about what I think is going to be a pretty significant change for a lot of people, especially if you've been on Medicare a little bit. And that is the government is going to be assigning new Medicare numbers. And this is for security reasons. You know, currently your Medicare number is your Social Security number with a letter after it. Or if you're doing that with your spouses, maybe a deceased spouse, you're drawing through them or something, it may be a spouse's Social Security number. But it is a Social Security number with a letter, and everybody knows that. And so if a person were to steal your wallet, or you were somehow lose your Medicare number, or if your Medicare number was not dealt with securely by a provider, or someone that overheard you say it or something like that, then they would have your Social Security number, and that's not a good thing. So the Centers for Medicare and Medicaid will be replacing your Medicare number with a new alphanumeric number that will not be your Social Security number. And I know this is going to be a little bit of a annoyance for a lot of people, because for most of us, we have our Social Security number memorized, and so it's easy to just rattle that off or write it down on a form for a provider. But just be a little flexible with this. You are going to have to, replace your Medicare card, and you're going to have to keep up your new card, because I don't know, the way it sounds, this may not be a number that you can easily memorize, or if you're like me. So I have trouble just remembering all my passwords. But anyway, new Medicare cards with new numbers are coming. It will start, that process will start in April of 2018 and will extend for a year. So you may not hear anything about it until 2019, but just know that that's coming. And there's no charge for that. There's no, you don't have to do anything. It's just going to happen. So don't be concerned about it, but just be aware and look for it. But also be aware about scams or people trying to take advantage of you around that process. Because, anytime something changes, there are people out there that want to take advantage of situations. And so just be aware that that's going to be happening and your cards will be changing. So look for that. Let's see. Anything else we need to talk about changing? Okay, can't think of anything. So I guess that's it for now. This is Wanda Holt, and this is the first Friday in October. So I hope you enjoy this cooler weather. It's always a wonderful time. I am a big pumpkin fan, and so I love all the pumpkin flavorings and pumpkin bread and pumpkin pie and all those sorts of things. And Thanksgiving is one of my favorite holidays, and so I always look forward to that. So bye for now, and if you have any messages for me, just contact me, and love to see you during this Medicare open enrollment.